The head of the World Health Organization, Tedros Adhanom Ghebreyesus, has said Delta and Omicron variants are twin threats that are leading to a tsunami of cases. He made this assertion while briefing journalists in Geneva on Thursday on the Omicron variant. We have details in this report.
New cases of COVID-19 in the United States have soared to their highest level on record, likely driven by the highly contagious Omicron variant. Australia also hit a new record on Thursday, as it narrowed its definition of close contact of coronavirus cases and relaxed requirements for tests in a bid to relieve pressure on testing sites. WHO Chief Ghebreyesus noted that the pressure on health systems is not only because of new COVID patients requiring hospitalization, but also a large number of health workers getting sick themselves.
This virus will continue to evolve and threaten our health system if we don't improve the collective response. Right now, Delta and Omicron are twin threats that are driving up cases to record numbers, which again is leading to spikes in hospitalizations and deaths.
Mr. Ghebreyesus, briefing journalists from Geneva, called for leaders of government and industry to walk the talk on vaccine equity, both by ensuring consistent supply and helping to get vaccinations actually into people.
In the year ahead, I call for leaders of government and industry to walk the talk on vaccine equity, both by ensuring consistent supply and helping to get vaccinations actually into people. This is the moment for leaders to banish the politics of populism and self-interest, which are derailing the COVID-19 response and threaten to undermine the response to the inevitable next disease X.
Earlier in the year, during meetings of the world's biggest economies, the G7 and G20, WHO challenged leaders to vaccinate 40% of their populations by the end of 2021 and 70% by the middle of 2022. With only a day left in the year, 92 out of 194 member states missed the target. Also briefing journalists, WHO's Health Emergency Program Executive Director, Dr. Mike Ryan, said the acute phase of the pandemic can end in 2022.
With regards to the pandemic, we've been saying this for a very long time, the acute phase of the pandemic that's been associated with the tragedy of death and hospitalizations, that can end in 2022. The virus itself is very unlikely to go away completely.
WHO's chief scientist has also said all lab studies are pointing towards a reduction in neutralization capacity of vaccines.
Now, the evidence on Omicron is just emerging, and I think it's still premature to conclude definitively. But I think what we can say is that all of the lab studies are pointing towards a reduction in neutralization capacity. And also what we see clinically is that people who've been vaccinated, people who've had prior infections are still getting breakthrough infections with Omicron.
For her part, Dr. Janet Diaz, who is WHO's lead in clinical management response to COVID-19, said more data is needed to understand the severity of the Omicron variant.
It's too early right now, and we still must be cautious when trying to ascertain the severity of Omicron virus infection. We do know that there are some suggestions of the reduced hospitalization coming from some countries, as was already discussed. But we need to know also, of those hospitalized, how many are on oxygen therapy, how many are requiring intensive care or mechanical ventilation, and how many are dying. So we do need to get a better understanding of that spectrum of severe disease in patients infected with Omicron.
1.8 million deaths were recorded in 2020 and 3.5 million in 2021. But the actual number is much higher. There are also millions of people dealing with long-term consequences from the virus.